Dr. Vitalis Ogola. I'm a dentist at Royal Dental Clinic in Kisumu, Homa Bay, and Migori. Today we have partnered with Ponea Health to create awareness on various dental issues, and the one for today is about bad breath. How does bad breath come about? Bad breath is a very common problem in our society that often make many people shy away from having ease of interactions with other people. There are very many ways that one can end up having bad breath. The main factor that leads to people having bad breath is failure to observe good oral hygiene. That means that if you don't get to brush your teeth regularly, effectively, you will end up with bad breath. If you neglect any dental problem in your mouth, like you have a cavity that can easily hide food inside the cavities in your mouth, then you will end up with bad breath. There are other factors that may lead to people having bad breath that are not necessarily out of their own making. Some of them are people who have disease that could easily manifest as bad breath in the mouth. Others are on medication, certain drugs that lead to bad breath. And there are people whose, no matter how much they take good care of their teeth beyond seeking to see dentists, end up with having bad breath out of things like calculus within their mouth. So, and then there are certain types of foods that people take. Occasionally, you've probably taken some foods that leads to bad breath. What are the predisposing factors to bad breath? The main one, of course, is people who neglect their teeth. If you don't brush routinely, then your mouth will accumulate dirt, something that almost everyone feels when they wake up in the morning. If you slept and woke up in the morning, we almost always end up with a bad breath. So if you don't brush your teeth, you'll have bad breath onwards. There are people who have illnesses, like the people who have cancers of the intestines, cancers of the stomach. It predisposes them to having bad breath. There are people whose mouth, because the mouth have different bacteria, there are people whose mouth have bacteria that lead to bad odor more than others. That will predispose them to having bad breath more than the larger population. If you have cavities in your mouth, as I've stated, they will hide food within the mouth, and then you'll end up with bad breath. And of course, generally, if your gums are swollen, it hides food particles that will also lead to bad breath. There are certain foods, of course, that I've stated, like I stated earlier. If you take onions, everybody knows if you take garlic, you'll always have that smell out of the mouth for a longer time. So those are just generally what would make somebody be predisposed to having bad breath over other people. There are people who, even if they clean their teeth so well, they will still have some bad breath from the mouth. Happens very commonly in children whose, as they grow, there's an imbalance in the type of bacteria that is found within the mouth, because all of us have some bacteria within the mouth. So there are certain children that in their mouth, they end up having more bacteria that lead to bad smell, which may be beyond their making. So they may be predisposed to having those kind of bacteria that makes their mouth smell more than other children. What type of foods lead to bad breath? The most common one that causes bad breath is onions, garlic, certain alcohol. Of course, if you take certain alcohol, you lead to having a bad breath. Cigarette smoking predisposes people to having bad breath. Of course, cat chewing predisposes people to bad breath. There's some which are short-lived. Of course, people who take fish end up with a bad breath, but it's for a short period. But the main one is onion and garlic and alcohol. Thank you for taking your time to listen in to the information that we've shared. We are grateful and hope that you've learned something from us. Should you seek to get our services, we at Royal Dental Clinic in Kisumu, Homa Bay, and Migori, feel free to reach to us through ponea.com, which is a platform that enables you get to us. And beyond this, there are many topics that will come your way in dentistry and others through Ponea in other episodes.